everyone. You are welcome once again to Health Matters. Health is worth and worth is health on ABL television. Thank you viewers for following us on YouTube, Facebook, Snapchat and all the other social media handlers. Also don't forget to watch us live 24/7 on Freeview and IPTV on abltelevision.com. I'm your host, Sakyibea. I'd like to say a very big thank you to all my viewers for the comments and the feedback you'll be sending in to me. It's helping us change things and also the way we broadcast this program. So keep on bringing it, keep on sending in the feedback, keep on sending in the comment, and I want to reassure you they are all being noted. If you want to advertise on this program, or you want to sponsor this program, or if you want to send greetings to your loved ones on their birthdays and other anniversaries, you are welcome to do that by contacting us on our social media. Medias. All the details are there. To continue, I want to also say send a shout out to my chairman, Mr. Daniel Entry, for all the words of encouragement and for your support. I'll say thank you so much. I really appreciate it. And I haven't forgotten the topic you want me to educate viewers about. In due course, I will be treating that, and when I'm ready to be treating that, I'll let you know. So today, what am I going to talk about? I'm going to talk about meningitis. But before we continue, please don't forget to like, share, comment, and press the notification button so that other people can also come in to listen to this information that I'm going to educate us on. Also, take your notebook or call a friend to also call a friend to also call a friend, so that we can all benefit from this educative topic. As I said, we are going to talk about meningitis. So when we say meningitis, what at all is meningitis? So meningitis is an infection of the protective membrane surrounding the brain and the spinal cord. What do I mean by that? Our brain and spinal cord has a membrane that surrounds it, that protects it. So when there's an infection of this membrane, then then that is when we call it meningitis. So meningitis can affect anyone. It can affect whether you are a baby, young person, old person. It affects everyone. But it's mainly commonly in babies, young children, young adults, older people over 65 years, and also people with a weak immune system. When I say weak immune system, people who are undergoing chemotherapy, or people who have HIV. So they are, most of the time I would say they are in the high risk of having meningitis, having this infection. But then it can affect anyone. It can affect, that's why we need to know about it. And when we see the symptoms and other things, we can just chase it up or seek medical help. So if we know what meningitis is, if we know those that can, we know it can affect all of us, or if we know those who are commonly like to have meningitis, then what are the causes of meningitis? What are the causes of meningitis? Meningitis, meningitis can come about either through virus or bacteria. Most of the time, the common meningitis that we see are caused by virus, which is less serious. They are all serious, but with the virus, meningitis is less serious. Then we have the bacterial meningitis, which is very rare, it's not common. But then when it's not treated early, or when it's not treated, or when it's not diagnosed early, it is the serious one. It causes a serious complications. So those are the causes. So we have the viral or the virus meningitis, and we have the bacterial meningitis. With the viral meningitis, most of the time it can be treated at home, but with the bacterial meningitis, we need to seek immediate help, and it has to be treated in the hospital, but we'll get to that. So how do meningitis spread? How can it be how can it spread? As I said, it's infection by infection to the membranes that is surrounding the brain and the spinal cord. So it can be spread when someone sneezes. So when someone sneezes, someone coughs, or through kissing, it can be spread. That's why it's very important when you have cold, because sometimes people who have meningitis, when they sneeze and all that, because they don't have the symptoms, they themselves don't even know that they have meningitis. So when they sneeze, they cough, and if someone kisses a baby or somebody, it can spread through that. So it's very important for us, when you are having cold, you are sneezing and all that, you use tissue. After you finish using it, you make sure you throw it into the bin, you wash your hands to prevent the spread of meningitis. Also, with in terms of how it can also spread, it's less common when someone who has meningitis can pass it on to another person. So it can happen, but it's not that common. But the most common ones are when someone sneezes, cough, and kisses somebody with meningitis. But then we have to all understand that same as flu and cold, is or even COVID that happened, you cannot say because I've had COVID, I'm immune to it, I will not have COVID again, or because I've had cold and flu, I'm not going to have it again. The same thing as meningitis, you can have it more than once. So if you've had meningitis, you have to know that it can happen to you more than once. So don't think now I'm immune, so I can just go on, or even when I have all those symptoms, I'll just sit at home and not do anything. So those we have to bear that in mind. So how can we identify someone with meningitis, or if we've talked about what meningitis is, how it's spread, what are the causes, knowing it can be either a virus or bacteria, how can we know that we have meningitis, or a loved one that we live with or someone close to us have meningitis, and when can we seek help? There are lots of symptoms of meningitis. One is when you have a high temperature. So high temperature, that's always, when I come on this program, I always say you can get your thermometers, you can get your blood pressure, all the equipment that we use in checking our blood pressure, sugar and all that, you can get them on Amazon, on eBay. You can have your own. So if you're having temperature, you're concerned about your temperature, if you have thermometer at home, you can check. Anything above 37.5, 38, you have to be concerned. It's high enough for you to seek help. Another symptom is when you constantly have cold feet and cold hands. Constantly have cold feet and cold hands. Vomiting. You can't keep things down. Once you eat something, you just have to vomit it out. Feeling sick is symptoms of meningitis. Confusion. You are breathing quickly. You've not had any exercise, but you can feel yourself when you climb stairs or you are just walking. When you are walking, you feel that your heart is beating. You are breathing quickly. It's also a symptoms of meningitis. And all the symptoms that I'm mentioning, it can be a symptoms for the virus or the bacteria. Both of them have the same symptoms. When you have muscles pain, joint pain, you look pale, and some people, when you talk to them, they'll be looking out for rash. Just to remind viewers that all the symptoms that I mentioned, you might either have one or two. Some have more than one or two. So don't think, oh, I'll wait for all these symptoms that you are mentioned before I'll seek help. Please, if you have one or two or three of them, please seek help. Go. I'll get into the end. I will let you know where you can seek it. But it's a serious infection, because it's infection to the brain, to the spinal cord, and when it does happen, it's very serious. So you need to seek immediate help by calling the ambulances. As I said, I will get back there, and when I get to that, the how to seek help, I'll let you know. In getting to the same thing, I said, it will not go in that order. Some people might start with a rash. Others, the rash will be the last symptoms that they will notice. If you have stiff neck, dislike to lights, when someone switch on lights, it irritates you, it's a symptoms of meningitis. Seizures, fits. When we say seizures, fits. All of you see that person has no history of epilepsy, but then all of a sudden they start fitting. Please, it's a sign or a symptoms of meningitis, which you need to seek help. In babies, for adults, you can voice out to say, oh, I'm not feeling well, I'm having temperature, I'm doing this. So then those around you, your loved ones, can help you seek help. But with babies, they cannot communicate with us. So when it happens in a baby, when you see some of these symptoms, like sometimes babies, they refuse to feed. You see, your baby has been feeding and is happy. All of a sudden, when you try to feed them, they are not taking the food. They are irritated. You try to make them happy. Nothing is making them, they are not excited about anything. Some babies also have a high pitch of cry. We know babies cry. That one we know, babies cry. But then your instinct, or when you say, no, this type of cry is not normal, high pitch of cry, please, you need to take your baby immediately for help. Sometimes, as I said, some also will develop rash. So the same rash, and I will show, getting to the end, I will show a picture of the rash that you should be looking out for. So these are some of the symptoms of meningitis. And we need to, once we notice one or two of these symptoms, as I always say, you seek help. If you go and it's not meningitis, fair enough, it might be something else which you get treatment for. But if it's meningitis and you stay at home without going to the hospital seeking medical help, you end up having serious complications. As I said, the bacterial meningitis is a sepsis. When you hear sepsis, that is infection of the blood. Bacterial meningitis causes infection of the blood, poisoning of the blood. So you can imagine, if you stay at home, then your blood is, you have this infection. Blood does everything for us in our body. It runs, it's fluids. It runs through our body, does everything. So if you sit at home and you don't seek help, it causes loads of things. lot of complications. So with the rash, as I was talking about, there are some rash. I know some people will say pimples and all that. There are some rash, different rash, but for you to notice that this is rashes or meningitis rash, when you press a glass to the rash, it will not fade. I will try and see if we can see it in the camera. Maybe my cameraman will help me show a picture to the viewers. So sometimes, unfortunately, if you are someone with a color like me, sometimes it's difficult for you to notice the rash. So the best place to notice such rash can be if you are someone with a color like in a color like me. You can look at your palm, which is a bit lighter than your skin. So your palm under your foot, or even when you open your eyes, the eyeball, you can open through and you will see those rashes. But then I don't know if my camera will see it. So these are some of the rash. This is how you see the rash. You can see with the lighter skin, it's more obvious for you to see. But if you are a woman, a person of a color, sometimes it's difficult. And the rash tends to be purple, dark brown. This is how I hope viewers can see well. And for you to know whether it's a meningitis rash, what you have to do is, if you look at the picture here, on the rash, you press an empty glass on the rash. So when you press the empty glass on the rash for some few minutes or seconds, and you take it off, and the rash does not fade. If the rash does not fade, like what is in this picture, you can see as it's being pressed on the rash, it's still there. You can still see the rash through the glass. Then it's meningitis rash, which is a cause for concern, and you need to seek medical advice. So I hope it's been seen well on the screen. Yeah, so you can see at my left hand side, pressing the glass to the rash. You can see the rash through the glass. If you see that, then it's meningitis rash. Thank you, my cameraman. Yeah. So these are some of the rash. As I say, if you are a lighter color, that one is obvious for you to see. But then if you are of a person of a different a color, you see sometimes it's difficult for you to see. Thank you, my cameraman, for that. Hopefully my viewers have seen the rash. So there are other rash. Once you press your glass to it, it fades. But with meningitis rash, you can press it to the rash, the glass to your rash. Once you take it off, it won't fade. So if it doesn't, please, it's a cause for concern. You need to seek advice. You need to seek medical help, medical intervention. So these are some of the symptoms and these are some of the things that you need to look out for regards to meningitis. So how can we identify meningitis? So if you have all these symptoms, the symptoms that I've mentioned, if you have any of these symptoms, you report yourself to your GP. If you mention it to your GP, or if you're cause of concern, the best way of seeking help is to call 999, or if you want advice, you call 111 111, and someone will advise you. If you call 999 and they take you to even if you think the ambulances are going to delay, please find the nearest A&E, accident and emergency, near you. Walk yourself in there and go for medical help. Once you get there, if they are concerned or they think that you might be having meningitis, what they will do is they will immediately start you on antibiotics. Once it's for precaution. As they are waiting for the test, they'll start you on antibiotics. They will do some physical examinations on you. Blood tests will be taken, and they will do a lumbar puncture. So lumbar puncture is where they take fluids from your spine, then they send it off so that they will identify whether it's a virus or bacterial meningitis, because knowing which one it is will help the health professional to give you the best treatment that you need. Then they will also give you a CT scan where they scan to check if there's any swelling in your brain. Remember, meningitis is caused by what? When there's infection of the membranes that surrounds the brain and the spinal cord. So they will give you a CT scan as well. Then when the results come and it's virus infection, you'll be sent home. The antibiotics will be stopped. Then with the virus infection, within 7 to 10 days, and having enough rest, at least you recover from it. If you're having headaches, you are vomiting, sickness, they can give you painkillers, give you anti-sickness to stop your vomiting, and also for the sickness. But then if it ends up being a bacterial meningitis, the treatment, they treat you in the hospital, whereby your antibiotics will be continued. Then you'll be given oxygen if you have issues with your breathing, and also if you are dehydrated, you'll be given fluids for you to be hydrated. Because of your vomiting, sickness, your body will need more fluids to help you with. So with all those treatments, once you've been discharged and gone home, research has shown that at least 1 out of 10 people who develops bacterial meningitis develops complications, serious complications. That's why I kept on saying throughout this education, saying that you need to seek help, especially when it's bacterial meningitis. It's a life-changing situation. Sometimes 1 out of 2 or 3 cases of bacterial meningitis are very fatal. So if you've been treated, people who have been treated with bacterial meningitis, 1 out of 10 of them develop complications. And what are some of these complications that they develop? Hearing loss, sometimes it's partial or total. Vision loss, some develop kidney problems. Kidney problems. Even some also lose their limbs. I've seen baby within minutes. They had this bacterial meningitis. Within minutes, it was just the only thing that they could do to save this baby was to amputate all the 4 limbs. That is the 2 legs and the 2 hands. So these are some of the complications: kidney problems, amputation of your limbs, vision loss, hearing loss, and sometimes your movement as well, because remember, our brain and our spinal cords help us in our movement, in our coordinations, in our memory, concentration. So some of the complications can also be problems with your memory, concentration, your coordination, movement, and behavior problems as well. Some even end up having wetting their bed. As it's kidney, so they can even though they've grown out, they can be an adult, but then they will start now wetting their bed. So please, when you start having these symptoms, I can't just emphasize it enough. Please seek for medical help. Some even end up having recurrent seizures, fits. They now be epileptic. But if you are somebody who you didn't know all this, you've developed meningitis, you've been treated, and now you've had all these complications that I'm mentioning, all hope is not gone. There's hope for you. If you've had hearing loss, they can have an implant for you whereby you can go for a hearing test after your treatment, that you'll be given a hearing aid. There are also counseling and psychological support for you as well, whereby you can go to your GP who can refer you, or you can self-refer yourself as well for this counseling. Because some people, after all this trauma that they've gone through, if their limbs have been amputated, if now they are wetting their bed, some even because of the trauma they went through to the hospital, they don't even want to go to near even an hospital again, or even see a doctor. When it's that way, you have you can go for counseling and psychological support from your GP, or they can refer you as well. If you want more information on meningitis, you can look out for the Meningitis Research Foundation. If you go on their website, there are a lot of information out there for you to access. There are vaccinations that we vaccinate children against meningitis, or for when you are vaccinated, when you are affected by the meningitis, the effect is lesser than someone who has not had the vaccination. So babies, when they are 8 weeks, 12 weeks, you go to your GP, the vaccination that they are given, meningitis is part of it. Teenagers, also, when it's time, your GP will contact you to bring your teenager, or when they get to 6th form and they are starting school as well, freshers, there is a booster for them. When you receive such letters, please don't leave it. Chase it up, call in your doctor or your GP or your nurse and book that appointment for your teenagers to go and have that vaccination. And also over 65 years as well, they have boosters for meningitis vaccination. Also, please, if you have any loved one, your mom, your dad, who is at that age, you can contact your GP if they've not sent her or him a letter, and follow it up so that they can go for that booster. So you can have vaccination against meningitis. So if you are not sure whether your child, yourself, or your loved ones have had all this vaccination, you can just contact your doctor, your GP, your nurse, and they have the history. They can go through your record and let you know, so that you can put your mind at ease. So when can you seek help? I've said it. When you have all those symptoms, please, you call 999 ambulance. If the ambulance will delay, find ways and means to immediately go to the nearest A&E, accident and emergency, so they can give you the treatment that you need, the help. You can call 111 111 as well for an advice. If they give you advice, you are still worried, please listen to your instincts. Sometimes your instincts can tell you, no, something is wrong. I need to seek help. When it's that way, or I need to seek help for my baby, my child, my loved one, or someone you're looking after. When it's that way, please, it's better to seek help than sorry. Rush yourself or whoever you are looking after straight to an accident, A&E, that's accident and emergency, so that the help can be done. So ladies and gentlemen, if you have any comments, you have any feedback, you have any questions that you want to ask me about meningitis, you can put it at the comment side, and next week I will touch on before our next topic. Thank you, and stay tuned next week.